Hi, my name is Rachel and I'm going to be doing a skills video on oxygen administration. Today I gathered my supplies. I grabbed some clean gloves, some gauze, a simple face mask, a nasal cannula, and my test person. Before I get started, I'm going to be checking the doctor's order and making sure that this patient needs the oxygen and at what rate. And then I'll go bring my stuff in with me to the patient room. I'll knock, come in, close the door behind me to give the patient privacy, and then I'm going to perform hand hygiene. Hi, Mr. Smith. How are you doing today? Great. My name is Rachel, and I'm going to be your nurse today. Your doctor prescribed you some oxygen therapy, some oxygen administration. And that's just because your oxygen level is a little bit lower than what the doctor was hoping for. So we're just gonna hope to get that a little bit up today. I'm gonna make sure to identify my patient using two identifiers. I'm gonna look at his wristband, and can I get your name and date of birth? Perfect, thank you. So now that I know that this is the right patient, I'm going to do a respiratory assessment. Okay, and now we'll get started. I'm going to apply my gloves. And we are going to be doing the nasal cannula today. This is a non-invasive way to get some oxygen in you. And the doctor ordered 2 liters. I'm going to plug this into the oxygen. Nasal cannula can go between 1 and 6 liters. So we're just going to do 2 because that's the doctor's orders. This just goes right into your nose and around your ears. So we're going to go in. Make sure that the prongs on your nasal cannula are pointed down. We're just going to go around the ears. Just to note, if you're using a nasal cannula and it's 3 or 4 and above liters per minute, you're going to want some sort of humidification because it can dry out your nasal and oral mucous membranes. So with us only at 2, we won't need that unless if the patient shows signs of needing it. So now that that's on, we're going to be doing skin assessments every 4 hours just to make sure everything looks good and there's nothing rubbing and causing skin irritants. So we're going to be putting this at the cheekbone, and at the ears. You're going to be doing that at both sides. So cheekbone and ears on this side as well. How's that feeling, Mr. Smith? Good? Okay. I'm going to educate the patient on the nasal cannula, and then we're going to do the treatment of oxygen administration. Now that that's done, we're going to remove it. We'll start out with the gauze. And then we'll remove it starting at the ears, coming out of the nose. And then I am going to dispose of this. Next, Mr. Smith, your oxygen wasn't quite what we were wanting it to be at, so we're going to try the simple face mask. I'm going to apply this to your mouth and nose, and this will supply some oxygen to you because I'm going to plug this into the oxygen. A simple face mask can receive oxygen administration of 6 liters a minute to 10 liters a minute. Your doctor ordered 6, so we set it to 6. And then now that that is done, we're also going to assess the patient's skin every 4 hours to make sure that everything's looking good. In this case, I am going to apply gauze to the cheekbone as well as the ear area on both sides of the patient. When you put the simple face mask on, you can also adjust using these green strands, but pulling them, making them tighter if they need to be tighter, and then also at the noseband. Mr. Smith, how is that feeling for you? Okay, good. I'm also going to educate Mr. Smith a little bit on the simple face mask, and now that his oxygen levels are at a better rate, we're going to remove it. We'll start out with the gauze. And then we're going to, while holding it, we're going to remove the band around his head, take the simple face mask off and dispose of it. And then we are going to ask how our patient's doing. So your oxygen levels are back, looking good. How are you feeling? Good. Okay, so we're going to thank our patient. Thank you, Mr. Smith. And then we're going to remove our gloves. And dispose of those. And we're going to make sure that all of our things are disposed of, including the gauze. And then we're going to perform hand hygiene. And thank you, Mr. Smith, for letting me take care of you. Please let us know if there's anything that we can get for you. I'm also going to make sure that our patient is comfortable and has a call light within reach. Please let us know if you need anything. We're right out there, and we're ready to help you. So I'm going to make sure that he's comfortable with the call light, and I'm going to go out, I'm going to perform hand hygiene and go out and document how the procedure went.